Hi, you're watching Hindustan Times. I'm Aditi Prasad. We are in the second wave of the pandemic, and many experts have already warned of an imminent third wave. So, how could the third wave be different from the first two? What can we do to protect? What can you do really to protect yourself and your loved ones from the imminent third wave of this pandemic? These, and there are many other questions from you, that is the viewer, which will be taken during this show. I'm joined by Dr. Rommel Tickoo, Director, Internal Medicine at Max Healthcare, and Dr. Ambarish Satwik, cardiovascular surgeon at Sir Ganga Ram, vascular surgeon at Sir Ganga Ram Hospital, to answer all your questions. Let me dive right in. I already have a list of questions that viewers have sent in. A very straight question by one of our viewers, at the rate Gayatri Srivastava, is asking, now that we know that the virus is airborne, what are the implications for apartments, which are enclosed? What are the implications for all of us, given the situation that we are finding ourselves in? And when is the third wave likely to hit India? She's asked three related questions, actually two. So, Dr. Tickoo, would you want to take the first question? Since the virus is now airborne, what are the implications for high-rise apartment complexes?
Well, we have to understand, Aditi, what we mean by airborne. Airborne doesn't mean it's in the air and wherever you are, you can catch it. What they actually mean is that in closed environments, in closed spaces where there is not proper ventilation, a small room, if somebody is positive and he coughs, the droplets remain suspended, the aerosols remain suspended in the air for a while, maybe half an hour to 1 hour. And if there's no proper ventilation, then you can catch the infection. If you are in the vicinity, if you happen to go inside the room or in that enclosed space, then you can get infected. This is what it actually means. Airborne doesn't mean that it's in the air and wherever you are, you'll get infected. Having said that, there are a lot of people who say that we never moved out of the house. We've been locked inside for like 3 months, 4 months. We don't know how we got it. But I'm sure there is somebody comes inside, or they go out for grocery or buying some pharmacy stuff or something like that. They don't wear a mask properly. I mean, half the people don't really know how to wear a mask. They think that they've done whatever it takes, but most of the time they don't. And it's the staff. If you're taking your dog out for a walk or whatever it is, or you're going out for a morning walk, I mean, you meet people, you tend to fiddle with your mask, you talk to somebody. I mean, that's how it gets inside. I don't think it's airborne to the extent that wherever you are, you can get it if you breathe the air. That's not what it means. Enclosed. So bottom line is, inside your house, there should be proper ventilation. Doors, windows, as much as you can, should remain open. If there's proper ventilation, then you'll not catch it. And that's what it basically means. Coming to the second part of the question.
I have a clarification on that first part. So if I want to go down in my society and go for a walk around my block, in open spaces, less likely chances of the airborne doesn't mean if I'm going for a walk in the evening to sort of exercise myself a little bit, doesn't mean that I'm going to catch it in the air if I follow all the COVID protocols. That is, wear a double mask, not touch anything, don't let the mask fall below my nose, and so on. Is that what you're suggesting?
If you're not taking precautions, you're not wearing a mask, you're going for a walk, you meet your neighbor, your friend, you have a chat with them, they're not wearing a mask, I mean, then you can catch it. But airborne doesn't mean that if you take proper precautions, you'll get it.
Okay, the second part of the question, Dr. Tickoo, you were answering. Sorry.
This is evolving and it mutates. There have been millions of mutations which have happened till now to this particular virus, but not all mutations will lead to problems in the sense that it doesn't become virulent, it doesn't become more infectious. There are certain mutations which are variants of concern. So that's how the virus evolves, and the way it's spreading right now, and it has to mutate in time. And when it happens again to that extent, we'll have a third wave. And when it's going to happen, nobody knows. We are still in the middle of the second wave. I don't think we've reached the peak yet. We might reach the peak in the next week to 10 days, and then gradually, maybe June onwards, we'll have a fall. It's too early to talk about the third wave. We might have third, fourth, fifth wave. We've seen what has happened in US, UK, Europe. They've had 3 waves, 4 waves. I mean, we just have to prepare ourselves. We don't have to let our guard down. We don't have to celebrate. We don't have to go for weddings. We have to make sure that we Don't get complacent. That's the only way. Wear your mask, whichever mutation it is, whichever wave it is, the mask will protect you. That's what we have to understand. And that's not what we've been doing till now. I'm afraid even now, people are not doing that. So when it happens, it will happen. First, deal with the second wave.
When it happens, it will happen. Deal with the second wave. Dr. Satwik, I want to bring you here at this point and say, what is your assessment? Do you agree that by early June, it will start, we will peak as far as the second wave is concerned?
Well, I'm not the best person to answer that question because you'll need a modeler and an epidemiologist to weigh in on those matters. But if I'm allowed to submit my observations on the earlier question, I think I'd like to offer a visual analogy for what it means to be airborne. First, I think it's not that the virus this time round is airborne. The virus was always airborne. Our understanding of the dynamics of transmission has evolved over the months through this pandemic. Now, earlier it was believed that the virus was largely transmitted through droplet transmission, what that meant was that if droplets are produced, respiratory droplets are produced, if you sneeze or cough or shout, these are large droplets which carry the virus in them. Now, these droplets, it was earlier believed that because they are large, by gravity they will fall on surfaces, and therefore they will their ability to move through space, spatially move, was limited, and therefore the whole messaging was around do gaz duri and 6 feet and this, that, and the other. Now, when you start realizing that the virus is airborne, it means that the virus is escaping not just in droplets. I mean, it is escaping in droplets, but it is also escaping when you are exhaling, when you're speaking or singing, and it is lingering on because when it's escaping through your breath, it's escaping as aerosols. And these are very light and they stay suspended in a sort of cloud around you. All right. And they have the ability, these aerosols have the ability to stay suspended in space for about an hour or a couple of hours. So the visual analogy that I like to offer is that of cigarette smoking. If you're even in a large room and someone in one corner is smoking a cigarette, if you're in the other corner, you're able to smell the cigarette smoke. That's exactly how the virus is behaving. All right, in a poorly ventilated room, because that cloud of smoke kind of dissipates and moves from one area to the other because there isn't any air exchange happening. So the virus is behaving similarly. If you are in an enclosed environment with poor ventilation, you are likely to be infected if you and the other individual who's infected, both of them are unmasked. All right. Similarly, if you enter a room where someone had been smoking about an hour back, you still are able to smell the smoke. That's precisely how the virus is behaving. So once you understand that analogy, you realize how easy it is to get infected in enclosed spaces, and where there's air conditioning and there isn't any air exchange. And particularly now you're seeing that economic activity, let's say in Delhi and Mumbai, is at a standstill. These cities are under lockdowns. Now, most of the infections that are happening are intramural infections. What that means is members of the household are getting infected because people aren't going to workspaces. There is no economic activity except essential activity. But if you've got one member of the family that's infected, it's summers, air conditioning is on, all the windows are closed, and if one member gets affected or infected, all the members of the household end up getting infected. And perhaps the most important thing to remember is that the ability of an individual to pass on the infection is perhaps maximal 1 day before he or she develops symptoms. Because once you develop symptoms, you're obviously, if you're coughing or if you've got a fever,
you put yourself in isolation. Yeah,
self-isolation, or others wouldn't come close to you. But 1 day before you develop symptoms, you think you're fine. And the fact is that you're not asymptomatic, you're essentially pre-symptomatic. And that's when you're shedding the virus and your ability to infect people around you is very, very high.
Okay. I hear you. I think that's very well explained, Dr. Satwik. But the issue is, so therefore, right now, when Mumbai, Delhi, a lot of other cities, a lot of people are in a lockdown mode, what are the key things that people should be doing at home to keep themselves safe. I mean, as you pointed out, asymptomatic, when you're asymptomatic one day before, that's the most likely chance of you passing on the infection to your other family members. What are we to do? Because then it is a very shadowy enemy. You don't know how to fight it.
Is that for me?
Yes, that's. I just wanted to ask you, what are things that people like me who are at home right now, working from home, what are we supposed to do? I mean, there are a number of people in the household.
Which is why you have to be. So the fact is that an individual is likely to be infected when they come in contact or close proximity with other infected individuals. So which is why universal masking. You always wear your mask. You're going to bring in the infection into the family, into the house. So whenever you're stepping out, you will follow COVID appropriate protocols. And with the current variants, the transmissibility of the virus is very, very high on account of the mutations. Therefore, it's much easier for you to catch the virus than it was the first time round, which is why perhaps it's more important when the epidemic is raging in your city or your community or your metropolitan area. You should wear tight-fitting masks. Perhaps when you're going into crowded environments and close spaces, you'll be well advised to wear the N95 mask. And this can be reused. You'd be well advised if you're going into a crowded space to wear an N95 and then to wear a disposable surgical mask on top, so that when you come back into your house, you can just dispose of the surgical mask and reuse the N95 for a few days. So you will bring back the infection if you're stepping out. And when you bring back the infection, you'll pass it on to your family members. For every person who's admitted in a hospital with COVID or has died, has caught the infection from someone else, who caught it from someone else, who caught it from someone else, right? So the chain of transmission has to be broken. Therefore, it is a fundamental responsibility of every individual to make sure that he or she is protected and would in turn protect other members of the family. And with the slightest development of symptoms in the household, that individual must be isolated and segregated.
I'm going to take a couple of more questions from our viewers, but before that, I have one question. This is what you just said. I was listening to Dr. Fauci on an Indian television channel a while ago. He was advising a 2 to 4 week national lockdown in India to break the transmission chain. Would you doctors concur? I'd like to go first with Dr. Rommel Tickoo on this.
If the positivity rate is pretty high, more than 10% in specific areas, then complete lockdown is the solution. I personally don't believe that weekend lockdowns and night curfews and things like that have any impact. I think if the way the things are right now, and there's an exponential increase in the numbers and there's a complete breakdown of the system, the healthcare workers, the healthcare infrastructure is so stretched, overwhelmed, I think a complete lockdown might be the solution, because it will have a significant impact on the dynamics of the outbreak right now in India. So to an extent, I do agree with him. But on the other hand, there are the other issues about the economy and the daily wages, the migrants, the laborers. They have to earn their living, but we have to sort of maintain a balance somewhere. But yes, the way things are, maybe a national lockdown is the need of the hour. Apart from that, again, we have to have hospital beds. We have to have a central command or an agency which handles hospital beds, oxygen. Now, people are dying because of the lack of oxygen or lack of hospital beds. Now, that is very, very unfortunate. We do understand that no healthcare system in the world can actually accommodate so many patients. Even if you look at US, Europe, or other countries in the world, even their system collapsed. So, but in India, with our kind of healthcare infrastructure, economic resources, it's pretty difficult. So that's why the need of the hour is to create more facilities and to get more supplies in place, whether it's remdesivir, whether it's tocilizumab, whether it's oxygen or the other infrastructure that we need. The need of the hour is that. The vaccination will bring its benefits later, maybe a few weeks, few months down the line. But right now, vaccination is not going to help us with this present wave. Right now, we have to break.
But anyway, vaccination process itself seems to be in tatters. I mean, we don't have enough vaccines for all our citizens right now.
So that's what I'm trying to say. So that benefits will come later. Right now, if we have to deal with it, bring down the numbers, break the cycle of transmission, lockdown, creating more facilities, maybe involving the army in setting up field hospitals, emergency beds, whatever it takes. That's what we need to do at the moment, because that's what people need. You need oxygen, you need
Doc,
hospital beds right now.
Dr. Satwik,
And
your view on a national lockdown?
Well, uh, my view is irrelevant because these things are kind of beyond my pay grade. But I would
No, but
agree.
to break the chain, yeah.
Yes, I would agree with what Dr. Tickoo is saying. You know, in school, we were introduced to the concept of exponential growth, and we've kind of forgotten what the meaning of the term exponential growth is. And so again, I'll offer an analogy which I have offered in the past, and this is for the benefit of your viewers. It was quite helpful for me to understand, because what happens is that as regards healthcare and healthcare infrastructure, there are rate limiting steps. You cannot suddenly expand your healthcare capacity and infrastructure. But the virus faces no such rate limiting step. So the visual analogy I'd like to offer is that of a sort of football stadium. All right. Now,
Yeah.
think of a football stadium. I mean, this is a thought experiment. You think you're sitting on the top row of a football stadium, and for whatever reason, this football stadium is sort of watertight. All right, and it's
Mhm.
filling up at the rate of 1 drop a minute. Okay, but it's filling up in an exponential manner. So it's doubling. So it is 1 drop at the end of the first minute, 2 drops at the end of the second minute, 4 drops at the end of the third minute, 8 drops at the end of the fourth minute, 16 drops at the end of the fifth minute, and so on. So let's say the football stadium starts filling up at 1 o'clock. Okay, how much time do you think you have to get out? All right, how much time do you think you have to save yourself? And I'll give you the answer. If it starts filling up at 1 o'clock, at 1:45, which is 45 minutes later, there will be water filling up till the first row of spectators. All right, you're sitting at the top row and you think you still have time. This is at 1:45 in 45 minutes. 3 minutes later, which is 1:48, half the stadium is full of water. All right, and 1 minute later, which is 1:49, the stadium is completely inundated. Right. So, and the interesting bit is that at 1:48, when you've got 1 minute left, you're at the top row, and you still think that the stadium is half full. So you still think you have time to get out. That is the meaning of exponential growth. So sometimes lockdowns are essential because you will not get time to react. Your healthcare infrastructure will have a rate limiting capacity of expansion. The rate of growth of the virus has no such rate limiting step unless you physically paralyze the system and have a circuit breaker in the form of a lockdown. So when you're seeing, as Dr. Tickoo said, and a lot of the other worthies in the Ministry of Health and Public and Family Welfare have pointed out that whenever you're seeing a test positivity rate of 10% and more, and you're dealing with such highly transmissible mutants and variants, it is perhaps in the best interest of that city or that district to go into an economic lockdown, because you have to stop people from mingling. And the only way of doing that is to stop all activity, all
Well, that seems to be that's a great analogy that you've given us, exponential growth. And so, what you're basically saying that is perhaps what is needed right now, given the fact that we are facing such death and destruction, at least in certain cities like Delhi and Mumbai, and now even Uttar Pradesh. I'm going to go to our viewer questions because I don't want them to feel shortchanged. I think I should really start taking them now. Truth Seeker 60403 is asking, masks are not really healthy, and I, for one, have a difficult time breathing in the, not to say two masks. You know, he's saying that instead of one, you asked me to put two masks. Uh, what he says that he doesn't think it's very hygienic. Dr. Tickoo, I'd like to take your response to that question. I think that's more an observation than a question.
well, I don't think it has any negative impact on your health. If you're wearing a, yes, it does sometimes give you a sort of a feeling of suffocation, but it's not harmful to the health unless you're like jogging and you're exercising while wearing an N95 mask, where there is hardly any space for air to go in. Then you might actually have trouble in breathing. Other than that, I don't think so. I don't think it's unhygienic. I don't think it has any major negative impact on your health as such, but it prevents you from getting a deadly disease like COVID. That's what you have to think. And think about the positives, not the negatives. And all over the world, people have been wearing the masks. All the healthcare workers, we wear 2 masks at a stretch for 8 hours. Then I have been wearing a mask, double mask for like 10 hours uh,
And
at a stretch, yeah, for so many, almost a year now. And I haven't had any major problems till now. And I don't think so. That's the way to look at it. It does prevent disease from getting inside your house. It prevents your family members, your friends, your colleagues from getting the disease. You can see what the impact of the disease on the nation right now. So a little bit of discomfort is a price which you can always pay for that.
right, absolutely. I'm going to take the next question now. Mahesh Ahlawat is asking, I'm from Delhi and recovering from wild virus. How likely am I to catch the AP variant? I don't know what the AP variant is. Maybe you will. Two in my family had intense virus and the rest mild one, but stayed at home. He's recovering from a mild virus. Now he's asking how likely is he to catch the AP variant? I think he means the
See,
more intense
yeah,
virulent strain.
any mutant virus strain, you can catch it later on. Immediately after you had an infection of COVID, you do develop some sort of immunity. Having said that, but nobody knows, we still need data on that, but there are second infections happening. But immediately after you had one infection, very, very unlikely that you'll have a second infection. But you still have to take precautions. You still have to wear a mask. You have to maintain COVID appropriate behavior. If you had a mild illness, you're recovering from it, doesn't really mean that you will catch the mutant strain again. But you have to think of the worst case scenario. You have to think that you can get it again. So even after 2-3 weeks after you recovered, you still keep doing what you're doing because there is still a chance that you might still catch it. I've had a couple of patients who got infected twice within a month or two. So the possibility is there, but very, very unlikely. If you take precautions, if you follow COVID appropriate behavior, if you wear a mask, then it's very, very unlikely.
Fair enough. There's a question for vaccines for children and a related third wave, which has just come in. Anshu at the rate Anshu Sharma is asking, it is being said that the children will be more affected by the third wave. Since the vaccine is not available for children right now, how do we protect our children? And that's really a valid question, Dr. Satwik. Would you like to take that? Because it's really about prevention.
Well, what had happened through the year was that most kids under the age of 15 were kind of kept locked up inside. And that effectively meant that these children were sort of virgin soil as regards COVID infections. They were naive to the virus. They had not been exposed. So it's extremely likely that kids will pick up the virus. And that is what you're seeing in the current surge. You are seeing a lot of children, a lot of adolescents picking up the virus and getting infected. But again, most of these illnesses seem to be mild. And well, there are trials underway in the global West for the efficacy of the vaccine in children and adolescents, and there are promising results that are emerging. But ours is a young country, so as regards demographics, 1/3 of India, which is roughly 30 to 33% of India, is under the age of 15. All right, so it's a significant chunk of our demographic monolith, and therefore any semblance of vaccine-induced herd immunity will have to involve this demographic segment. You cannot think of achieving any semblance of vaccine-induced herd immunity if you do not vaccinate children and young individuals. So, I mean, we're just waiting for more results, and I think as soon as they're available, and as soon as more vaccines are available, which have been tried and tested in children, they should be rolled out.
Interesting, even the Supreme Court yesterday said something similar. Supreme Court has asked the center really to prepare for the third wave and to actually make a plan to vaccinate children. And a lot of countries have started authorizing vaccines for children. I recently read that Canada has authorized vaccinations for children between 12 to 15 years of age. And even the US is planning to authorize such vaccines. I mean, hopefully the government will act and ensure that those vaccinations arrive in India sooner than later. But Dr. Satwik, I saw your tweet this morning about COVID blood clots, and there are some questions here relating to COVID blood clots. It read, COVID produces clots, the incidence of heart attack, stroke, or limb loss due to an arterial clot in COVID varies from 2 to 5%, you said. And I'm not showing the tweet here because you had put on a picture of a clot that you pried out of the lower limb arteries of a COVID patient. It was a bloody picture, and so I'm not putting it out here. But a question to you: are there more reports of COVID blood clots in the brain, hearts, lungs, or legs during this particular strain, which is active in the second wave?
What's interesting about COVID is that we're kind of learning on the fly. Through the year, we've been learning about the disease, and our understanding of the pathophysiology of COVID has evolved through the many months of this pandemic. And what happened was that early on in the course of the disease, as we were getting reports from China and New York and Italy, it was believed that the kind of illness that severe COVID is causing was similar to the acute respiratory distress syndrome that was noticed in other viral pneumonias. But subsequently, there were many extremely important autopsy reports that were submitted early on in the course of the pandemic, which revealed that what you're seeing is as much a consequence of microthrombi or microclots developing in the capillaries of the lungs as a direct attack on the lung parenchyma or the lung tissue. And subsequent to that, it was believed that COVID is as much a disease of blood vessels as it is a disease of the lungs, and blood vessels are everywhere in the body, and therefore it's entirely possible that the consequences of these clots developing would be seen in various parts of the body. So the virus basically attacks the lung, the inner lining of the air sacs of the lung, right? The adjacent neighbor of these air sacs of the lungs are the small capillaries inside the lungs. And it is also attacking the inner lining of the capillaries, the blood vessels inside the lung. And it is producing a kind of dysfunction inside these blood vessels and producing clots. Now, a clot is a colloquial term. The medical term is a thrombus. Now, a thrombus is the final product of a process called as coagulation. So when someone gets hurt, there's a cut on the skin or an incision, you will see that there is some amount of bleeding that is seen, but then it stops on its own. And this is an account of a process called coagulation. So liquid blood changes first into a sort of gel, and then it forms a kind of seal or plug, and that seizes the hemorrhage or seizes the flow of blood. And this is what happens in response to injury. But if these clots are developing spontaneously inside of blood vessels without any injury, they're going to form a plug or a cast within the blood vessel and completely cut off circulation to an organ or cut off venous drainage from that organ. All right. And this has been noticed as a direct consequence of both the viral attack on blood vessels and the immune response to the virus. So the thrombosis or the clotting that is seen in COVID has been called immunothrombosis. Okay, it's not plain old thrombosis. It's a combination of a response both by the attack by the virus and the immune response. It's like a category 10 hurricane that is set off within the immune system that is producing this thrombus. Now, the photograph I tweeted out was blood clots that I had retrieved through the lower limb arteries. And this patient presented with a sudden acute circulatory cutoff, which necessitated an immediate operation to retrieve the thrombus. Otherwise, this patient would have ended up losing his limb. An amputation would have been required. And in admitted patients of COVID, the incidence of developing such arterial clots is somewhere between 2 to 5%. And we've been getting hordes of such patients. In fact, this week we've done about 4 such cases back to back. One of mesenteric ischemia, which means an acute circulatory cutoff of the intestines. 3 of involving circulatory cutoff of the upper and the lower limbs.
So what should patients be really looking out for? I mean, how can is there something that people can do? Is there something that people like me can do? If you've got COVID, what are the things that you need to do so that clotting doesn't happen?
So one of the things we haven't figured out, and that's the puzzle we haven't unlocked, is who exactly is susceptible to the complications of COVID. Is there a sort of genotype that is more susceptible? Is there a kind of inherited mutation in a certain subset of people that is making them more vulnerable? Is there a deficiency of interferons, perhaps, or a specific kind of antibodies against some other interferons? What is it that is making you susceptible to the virus? And which is why it somehow feels like Russian roulette. You don't know who's going to go down. You know, it's entirely possible that octogenarians, people in their 80s, are merrily surviving COVID and, are completely coming out completely unscathed and unaffected. And you find 30-year-old people dying of stroke and other complications and ending up with severe lung afflictions. So you really don't know who is going to suffer. That's the bit we haven't unlocked. But what we have realized that in the course of the illness, if there is a sudden rise in the inflammatory markers, which is why many individuals are advised to get a set of blood tests done around day 5 and perhaps track these tests if required subsequently. If there's a sudden escalation in some inflammatory markers and a rapid escalation in the inflammatory markers, it's highly likely that these are the individuals who might suffer complications of COVID. And one of the complications is obviously blood clots. So, which is why if you are falling in that category, you must constantly be in touch with your physician. And if any new symptom were to develop in any part of the body during the course of your illness, you are supposed to report it to your physician and get it properly investigated. If there's a clot developing in the veins, which are the blood vessels draining a certain part of the body, for instance, if there's a clot developing in the lower limb veins, there will be swelling or pain of the legs. If the clot were to dislodge and suddenly travel to your lungs, you'll be acutely and suddenly breathless, because breathlessness doesn't happen acutely and suddenly in COVID. It's more insidiously played out. But if there's sudden onset breathlessness, that could be an indication of pulmonary embolism or a clot migrating to your lungs. And if arterial clots are developing, there will be sudden excruciating pain in a part of your body, perhaps your extremities or perhaps in your abdomen, or signs of, and symptoms of a heart attack, which is a sense of pain and constriction and tightness in the chest, or pain radiating from the chest to the left arm or to the jaw, or sometimes to the back. There could be lightheadedness and other such symptoms. There could be transient ischemic attacks of the brain, which could manifest in the form of sudden onset weakness in a part of the body, or transient or paralysis of a part of the body, or a sudden loss of consciousness, or visual disturbances, or slurring of speech, or something like that. So any new symptom that's developing in the course of the illness should immediately be reported and investigated.
I think that's very useful information for many of our viewers. I'm going to take a couple of questions from our viewers. Ritika Sachdeva is asking Dr. Tickoo, for diabetes patients, suggest something regarding COVID and any precaution symptoms. And diabetes patients, really, it's not just her. I understand that there are lots of questions regarding that, because the use of steroids in the treatment of COVID patients might actually be making their onset of diabetes really and making your diabetes worse, is what I hear. But please do clarify, give us a scientific opinion.
Well, diabetes patients are a high risk for complications of COVID. We all know that. Diabetes patients, cancer patients, immunocompromised patients, cardiac patients. So we have to be very, very particular about this subset of patients. First of all, they have to make sure that your sugars are under control if you have COVID. So whoever is your physician, diabetologist, endocrinologist, be in touch with them. Keep checking your sugars at home with a glucometer. And if you have end organ damage related to diabetes, in the sense that you have kidney failure or chronic kidney disease, then all the more a reason that you have to be very careful about it. On top of that, if the disease progresses like it does in certain people beyond 5-7 days, then you tend to have lung involvement. And then if you do a scan, or if your saturations are dipping, or you're coughing, you have persistent fever, your inflammatory markers go up, then you need steroids, because that is the treatment. Until now, steroids are the only drugs which actually reduce mortality. So there is enough evidence of that now. It's not the antiviral medicines, it's not the antibiotics. So if you happen to be a diabetic and you need steroids, you need a very tight control of your sugars, because steroids increase your sugars. And if your sugars go haywire, then you have a tendency to get secondary infections. You can get secondary bacterial infections in the chest. You can get a pneumonia on top of the viral pneumonia, which you have. We see a lot of urinary tract infections in diabetic patients, especially if the sugars go up. And most of the patients who are diabetics and who have a progressive disease actually need steroids. And that is something which is very, very important. Strict control of blood sugars when you have COVID and you are on steroids and the disease is progressing. So that's why we say these patients actually need to be admitted, because their sugars have to be monitored. They have to be given insulin. Most of them are on tablets, actually. So during COVID, when they're on steroids, the sugars can go up to 400, 500 odd also, and you need very, very strict control of sugars.
Okay.
The second part of your question, steroids, I mean, a lot of people, I do see prescriptions, and there are a lot of people who listen to their family, friends, or somebody in the family had it, he took this, he got better, why don't you do this? There's a lot of sort of suggestions coming from all ends. And even in your WhatsApp groups, people are suggesting, hey, you didn't take steroids, you're going to get a progressive disease. And people are actually listening to them, and that's not what they should be doing, because it has to come from the experts. Listen to the experts, go with the medical advice, because there's enough evidence, even in the recovery trial, told us that if you use steroids initially, especially in the first 5 days of the disease, it increases the viral load, it increases the viral replication. And in fact, the mortality was more in that group if you use it initially on, and when you don't have respiratory distress, if your oxygen levels are not dropping, if your inflammatory markers are not high. And if you're starting it, I have come across a lot of patients who are taking steroids from day 1, day 2, because they have high-grade fever, because it doesn't respond to paracetamol and anti-inflammatory medication. They think the shortcut is to have steroids because it immediately masks your symptoms. Your fever goes down, and it sort of masks your CRP, everything, all inflammatory markers go down. But what happens eventually is, after a while, after 48, 72 hours, the disease does progress because the virus keeps replicating inside your body. And then beyond 7-8 days, you have a fulminant pneumonia. I've seen quite a few such patients who got better post they took the steroids initially after 2-3 days, and it gives you a sense of well-being, a false sense of security. Actually, you think that you recovered, but you've not actually. And when you repeat your inflammatory markers after, say, another 3-4 days, your CRP has gone up, your ferritin has gone up, the entire blood picture has gone haywire. And that's when you're in trouble. And that's when your saturations start dipping, you start developing persistent fever and cough. We hear about a lot of patients who say, I was getting better, I thought it's all done and dusted, 7-8 days I was fine, but suddenly I developed fever. We do keep hearing about such patients. And they're the ones who actually self-medicate, or unfortunately, they've been asked to take steroids initially on, which is a very, very wrong practice. And I'm dealing with a lot of, I'm sure the other physicians or respiratory medicine specialists are dealing with such patients. It's become a nuisance,
Right.
actually. Most of them are having steroids. They should not be doing it. They should get in touch with your doctors, because initially the treatment is all symptomatic. Even if you don't take antiviral medicines, favipiravir, or if you don't take doxycycline or azithromycin, it's not going to make much of a difference, because they're antibiotics. Antiviral medicines don't have much of a role. If you take it early on in the disease, then it does help in reducing the viral load to an extent. So these are the things they should be aware of. So don't self-medicate. Maximum you can take paracetamol.
Right. Don't self-medicate. That's the message coming in from from our expert doctors here. There is a question which had come in and which related to blood clots, and I want to address that to Dr. Satwik. Is the hemoglobin level related to blood clots? Priya S is asking.
Not in COVID. Not in COVID. COVID, there's absolutely no correlation with your hemoglobin level and the formation of clots. The formation of clots in COVID is a consequence of the influence of the virus on the inner lining of blood vessels and the immune response to it. Hemoglobin levels have no role to play.
All right. Thank you. I think that answers your question. There's another question here from Siddhant Desai. How to clean an N95 mask? I don't know whether the doctors can advise on that, but Dr. Tickoo, how to clean an N95 mask? Does it need to be washed? Siddhant Desai is asking.
No. N95 masks or surgical masks are not washed. You'll spoil them if you do that. But having said that, you can use it on a particular day. Like you keep a set of 5 N95 masks, which you use on a particular every Monday. So you can use it for a month or so. But don't clean them. Don't use any sort of disinfectant. Don't wash them. You'll spoil them. The only masks which you can wash are cloth masks. No other masks you can wash or clean. So keep a set. N95 masks, they are in shortage, but now that we are getting enough of those. But if you really want to reuse them, then keep it for a particular day. Keep 6 N95 masks for a week, 6 or 7, and keep using them for a month and then dispose them off. That's how they can reuse them. But don't wash them, don't clean them.
Okay, I know I know that I have limited time with you, so I'm going to ask you a couple of quick questions which have come in from a lot of viewers. We are flooded with questions. There's number of questions have come in on who can donate plasma and who can't, and what are the do's and don'ts, and I will come to that. But first, I want to talk about what you were discussing about diabetes, and there is a question related to that. Somebody's asking, researchers have found out whether COVID-19 isn't just deadlier for people with diabetes, but it's also triggering the metabolic disease in some who did not have it previously. Is that true, Dr. Tickoo?
Body can increase your sugar levels, and if you are a pre-diabetic or a borderline diabetic patient, your sugar levels will go up. If you're already a diabetic, then all infections do tend to increase the sugars to some extent. And if it's not well controlled anyway, it's going to go beyond the limit. And as I said earlier, lots of these patients are on steroids. So it does tend to sort of fluctuate the sugar levels. So it's not that the virus itself leads to diabetes. We can't say that. But any infection for that matter, any stress insult on the body can increase your sugar levels. And that's what seems to be happening. If the sugars were well and controlled before the particular patient had COVID, then it does tend to go haywire a little bit. It also depends on the medicines that you're taking. It also depends on your diet, because everything goes haywire and your stress levels are high. And then on top of that, you have steroid medication to worsen the sugar levels, to increase it further. So that's what we mean when we say that.
Okay, and there's also something about, a combination of diabetes, COVID, and steroid use has also, been also hearing about an upsurge in invasive fungal infections, something that people are calling the black fungus during the pandemic. Your take on this, Dr. Tickoo? Is that really happening, or is it?
Yeah, it's not very, very common, but we do see it in immunocompromised patients, diabetic patients, somebody who's been on steroids earlier. So you do get this invasive fungal infection, which is mucormycosis, which usually affects your face, your sinuses, and your eyes. And it can be invasive. It can go inside the brain. So it is a very deadly infection. And the treatment is prolonged, and you need sometimes surgery also. So, but having said that, these are not very common, but yes, we come across such cases, but usually in immunocompromised patients or somebody who's been on steroids or diabetic patients. So that's why it's important for us to keep track of your sugars and keep a track of your immunity status and make sure that you're in touch with your doctors. But yes, this is a complication which can happen. And there was a series of patients which actually I'd read about in Ganga Ram only. There were some patients some time back, but even in our hospital, we've come across patients of mucormycosis. It's the worst sort of a fungal invasive disease that one can have.
So if you're self-isolating and you're treating yourself at home and you have diabetes and you are sort of in self-isolation at home, what are the symptoms that you should watch out for this fungal infection?
You'll have heaviness in the face. You might have drainage coming from you might have secretions from the nose, facial swelling, redness in the face, headaches. These are the common symptoms. Sinusitis kind of symptoms, stuffy nose. And
Okay.
if it doesn't settle, or if you feel there's an obvious swelling on the face, intense headache, watery eyes, and if you're diabetic and you have high sugars and it's not getting under control, then you should be talking to your doctors. The ENT surgeons usually take care of this. So get in touch
All right.
with a physician or an ENT surgeon.
All right. At the rate Aman Sharma is asking, what should mild symptom patients need to do once they have recovered? Since this time around, there is news about increased heart attack in recovered patients. Dr. Satwik, would you like to take that question?
Well, as I said, that usually these complications are not noted in patients who've had a very mild episode of the illness. But at the same time, I would like to say that I don't think you should declare that you have a mild illness unless you're completely out of it. All right, you have to be wary and vigilant, and and be constantly aware of what can go wrong, and be in touch. But of course, as I said, that through the illness, and perhaps in the immediate convalescent period of the illness, which is about a week to 10 days post recovery, you should be aware of any new symptoms that might be presenting themselves, and immediately report to your physician who's been treating you. But as I said, don't treat any episode of COVID as a mild episode unless you're completely out of it.
Okay, fair enough. Dr. Tickoo, there's another question, and then I'm going to release the both of you very soon. I know you have patients waiting and you have other things to do, but I have more and more questions coming in. What is the effective, the person has framed the question wrongly, but I'm just going to ask it. Effective blood sugar levels during COVID, I think, and if you're a person with bronchitis or with BP, how should you take care of yourself during COVID? I think that's the question that the person is trying to ask. Dr. Tickoo?
You have to keep a track of your sugar levels. If you're a diabetic, you have to have a glucometer with you at home with which you check your sugars pre-meals, before breakfast, before lunch, before dinner. See, in ideal circumstances, your fasting blood sugar should be less than 100 milligrams per deciliter, and random sugar readings or pre-meal sugar readings should be less than 140. So that's what we would go with even during COVID, unless you're on steroids, and then your sugar levels will go up. But if you ask me, less than 200 is what we'll take any day, random readings. So we don't have to be over aggressive, yes, but we have to keep a track. But beyond 200, then you have to be a little more aggressive, maybe increase the dose of the insulin, or maybe increase the dose of the oral medication that you're having. But the ballpark figure, I would put it at 100 to 200, nothing much to worry.
Okay.
But yes, do keep checking, do keep a track of it. Send your sugar readings to your physician, let them go through it.
What about blood pressure patients and bronchitis patients? Because there are a host of questions coming on
Blood
that.
pressure, anything less than 140/90 is normal, but 140/90 and above, you have to keep a track. Don't self-medicate. Don't overdo things. If it's beyond 160/100, definitely you need immediate attention. So again, you don't know what you have to do. So you get in touch with your doctors, keep a track. Don't check 100 times a day. You don't get obsessed with it. But if it's high, just talk to your, sometimes it's transient, sometimes it's secondary to stress, or maybe it was steroid induced, because steroids not only increase the blood sugars, they also increase your blood pressure. So keep a track of it, report it to your physician. Maybe you need some titration, tweaking of your medication. Maybe most of the patients who are having COVID are actually having an increase in the blood pressure levels. That's what I've personally experienced. So we have to increase their medication for some time at least, and post their recovery, the blood pressure levels come back to normal, and maybe we can go easy on the dose later on. So basically, it's about keeping a track, checking it, sending it across to your doctors, and they'll guide you as to how to go about it, because you want the sugar and the blood pressure to be under control during COVID, so that you don't get the other complications along with whatever COVID is doing.
Right. Himanshu Madhaik is asking, is there any correlation between vitamin D and COVID infection? Vitamin D deficiency, I think he means, and COVID infection. If you can just give me a yes
Yeah,
or no answer.
there's a lot of evidence that people who have vitamin deficiency tend to have a more
Oh,
issue with COVID, or the tendency is to have more of it. Has a lot to do with immunity actually. Now, vitamin D has a lot to do with sugar levels also now, and immunity. Yes, it has a lot to do with immunity, because if your immunity is low, then you tend to catch infections, and COVID is also something which will hit you if your immunity is low. So vitamin D is something that you have to take care of beyond supplements. Check it whenever you're doing a blood check. Just check your vitamin D levels. 80% of the population, anyways, deficient in
exactly. I was just
vitamin D.
about to
Yeah,
say I am deficient in vitamin D, just like 80% of the population is. So that makes all of us susceptible to COVID, and we
yeah.
need to take
So
better
we need to.
care and precautions. And I don't want to take much of your time, but I do want to, because there have a lot of questions that have come in on who can donate a plasma or not, and under what circumstances, what are the caveats for plasma donation, because plasma therapy, convalescent plasma therapy is one of the key ways in which lives can be saved for people who want from by people who've already recovered with COVID. So if Dr. Satwik, would you like to take that question?
Uh, I don't think, first of all, I would disagree that I don't think there's uh, any great deal of evidence that convalescent plasma actually saves lives. All right, this is the jury's still out in it. So I would rather, I think,
But doctors are prescribing it. I know of a friend whose relative needed it, and who I got a desperate call in the middle of the night, saying that the doctors are asking for this, and where do I get it? And we were up till midnight, and I think that's the status with everybody,
sure.
because the doctors are advising it, and hence I'm asking that question. I think that's why so many
I,
people are asking that question. Yeah.
I agree. I agree. I mean, what I'm saying is that there isn't any clear-cut evidence in favor of convalescent plasma changing any sort of outcomes as regards COVID. But you're right. A lot of physicians are prescribing plasma, and there is some anecdotal narrative around the benefits of convalescent plasma. Well, eligibility for convalescent plasma would include anyone who has recovered from COVID, and roughly 2 weeks after they've recovered from COVID, they can donate plasma. Obviously, you should be above a certain body weight, 50 kilograms. You shouldn't be a cancer survivor, shouldn't suffer from hypertension or insulin resistance or diabetes, or chronic kidney disease. And pregnant women, on account of certain cross reactivity, shouldn't be donors of convalescent plasma. But I think Dr. Tickoo will be in a better position to give more advice on this.
Absolutely. Dr. Tiku?
As as Dr. Satwik rightly said, anyone who has recovered from COVID, 2 weeks post recovery, up to 3 months, you can donate, because it also depends on the titers of your antibodies. So, first of all, you need to have a positive report and then a negative report that you had COVID and you recovered from COVID, and then your titers. There are three things that you have to look at. And then you can donate. And women who had children in the past cannot donate for obvious reasons of immunity and cross reaction. And other than that, elderly, the ones who had hepatitis in the past, blood infections, uncontrolled diabetics, they cannot donate. And 60 and beyond, 50 and beyond, we usually avoid. It's young, healthy people who have recently recovered from COVID and have a good antibody titer, ideal candidates for donating plasma. Beyond 3 months, it might be of no use. But I do second what Dr. Satwik said, that there is not enough evidence and there is no need to rush, run, buy it in black or whatever and get desperate about it, because there is no evidence which says that it does save lives. And so goes for remdesivir. People are buying remdesivir in the grey market, buying it for lakhs of rupees. I personally don't feel it really helps much, especially in those patients who are already having a progressive disease. They've had pneumonia, they're 10 days down in the illness. Viral replication doesn't happen then. Viral replication happens in the first week. So how does remdesivir help you when you're on oxygen and when you are having a full-blown pneumonia? The indication is not right, according to me. And that's why the drug failed in most of the trials. And the largest trial in US, which was done on remdesivir, also showed that it just decreases the hospital stay by 1 or 2 days. There was no decrease in mortality. And even with plasma, it hasn't reduced mortality. So most of the studies and scientific evidence that we have today for remdesivir and plasma says it actually does nothing much. Having said that, because you have nothing else to give, so you do try. You won't just sleep over it. So you do try, maybe 5%, 10%, whatever benefit it gives you. And with mutant strains coming around now, the evidence about the plasma recovered from somebody who recovered 3 months back, 2 months back, might not actually help, because the antibodies which this plasma has might not be working against the mutant strains.
Right.
So basically, plasma and remdesivir, you have to take it with a pinch of salt. Don't get desperate. Don't buy it in black market. If you're not getting it, leave it. If you're getting it easily, fine. If you're not getting
But
it,
if your
take
doctor
it
is
easy.
telling you the hospital in which your patient is admitted, and the
Yeah, if
doctor
you're
is
getting
telling
it
you,
easily, go and get
go
it.
fetch
But don't.
remdesivir.
Yeah, yeah,
Uh,
because
as
there's
a
nothing
relative,
else. There's
as a
nothing else you can do.
caregiver, but as a caregiver, what do? You're
Exactly.
not able to find remdesivir. Your doctor's saying, "Get me remdesivir." You will try every option, knock every door, and beg, borrow,
I
steal,
understand.
and
I
try to get it
understand that.
from
But
anywhere.
that's why we're making people aware by telling them it doesn't do any wonders. If you're not getting it, fine. I also tell my patients get it. But I don't tell them to hunt for it all over the place or buy it in lakhs of rupees. I tell them if you happen to buy it, if you can get it, fine. If you don't, see, it's not a wonder drug. It's not going to do wonders. It's not a life-saving drug. Maybe it will help to some extent. So that's the message which should go across. We don't want to tell people that this is water, it doesn't work at all, so don't waste your time on it. That's not the message that we want to send here. The message is that we don't have enough evidence. Maybe it does help a little bit. Maybe we need more evidence in future. But don't get desperate. Don't run around. Don't sell everything to buy it, because that's not how it is. Steroids are the only drugs which actually save lives. I've saved quite a few people in the last few days who were under home isolation, desaturating, not getting a hospital bed, very high dose steroids. They luckily had oxygen concentrators at home, and now their saturation has come back to normal. They've actually recovered. So it's amazing how they've recovered at home with high dose steroids. And nobody talks about high dose steroids. They keep talking about remdesivir and plasma. So this is the message. You ask any pulmonologist who's dealing with, ask any physician who's dealing with sick patients, they'll tell you the role of steroids in in complicated COVID or patients who are having respiratory failure and pneumonia. So I'm not a big fan of remdesivir and plasma. I don't think they save enough lives. That's what I want to tell you.
I think these are very valid observations. Thank you, Dr. Tickoo and Dr. Satwik. I think our viewers are much more educated and getting a lot of thank you messages both for Dr. Tickoo and Dr. Satwik for clarifying a lot of doubts. Before going, there are of course questions like, do I need to wear a double mask? Please go back and go back into this show. The doctors have unanimously said, yes, you need to wear a double mask. I don't need to ask them that again. There is a question, however, there's a question on vaccine hesitancy again. There's somebody, Sahai Abhinav too, is asking, some people are claiming that vaccination actually increases susceptibility to infection. They cite instances of people turning positive despite taking the 2 doses. Should one take a vaccine at all in such a case? Now, I really seriously think nobody should have any questions regarding vaccines anymore and hesitancy thereof, but it still comes. So, really, I would really like Dr. Satwik, if you could just say a couple of words and then we'll wind up the show.
Whoever should take a vaccine, whoever is entitled to getting a vaccine should get vaccinated. You are better off with a vaccine than without. Practically all the evidence that we are getting from all across the world seems to suggest that vaccines are making a difference. Even if you are contracting the illness post-vaccination, vaccines kind of take the sting out of the disease, so you don't end up with severe COVID, and the chances that you will be hospitalized or might end up on a ventilator or die post-vaccination are really, really minuscule. So please go ahead and take that vaccine.
So please go ahead and take that vaccine. India is reeling under a deadly second COVID-19 wave, and the need of our A need of the hour really is for all of us to come together and fight back. The governments must come together and resurrect our faltering vaccine drive. And really, that's the only way to crush the second wave of the pandemic and prevent or lessen the impact of a possible third wave of the pandemic. Thank you so much, doctors, for joining us on this broadcast. We hope to have you again. Viewers, this show is every evening at 6 p.m. Please do join us again. We'd be happy to ask the experts to answer your COVID questions and queries. But for individual, please do not write in with individual complaints, because I can't. Nobody can give you tele advice without looking at your report. So the doctors here will give you broad-based advice, but please do visit your local physicians to get advice on your respective problems. Don't write in here. And secondly, do not self-medicate, as both our doctors have pointed out. Please, if you're showing signs, showing symptoms, please do visit a doctor to help you out. In the meanwhile, stay safe, stay tuned to Hindustan Times for all the latest updates. Dr. Tickoo, Dr. Satwik, thank you for your time.